In this video, we examine the effects of medicinal mushroom extract against cancer and profile some of the most promising types of mushrooms. As always, these ideas are discussed in more depth in the book Cancer Self-Defense 101, Quick Tips to Help You Survive. All citations for studies quoted in this video can be found in the book's bibliography at cancerselfdefense101.com. This video is intended as information, not medical advice. It is not intended to treat, diagnose, or cure any disease. Any medical advice should come from an appropriately credentialed medical professional familiar with your unique circumstances. Mushrooms are some of the strongest cancer-fighting foods. Mushrooms' mechanism of action against cancer is primarily immunomodulation. They upregulate underactive immune systems, downregulate overactive immune systems, and improve immune surveillance, meaning the ability of the immune system to perceive anything non-self. There are also numerous studies showing mushrooms' ability to increase natural killer cells, the most valuable cancer-fighting cells in the body. So the question becomes, when to eat mushrooms and when to take a mushroom extract supplement? We believe an anti-cancer diet should be chock full of mushrooms, so you may not need to take a beta-glucan supplement, as it is a key component of all mushrooms. But there are some mushroom supplements we believe are special and can be beneficial even outside of normal dietary consumption. Coriolus versicolor, also known as turkey tail mushroom, has shown efficacy fighting against cancer in human trials. Of particular interest is the branded version of turkey tail known as PSK. Medicinal mushrooms are so popular in Asia that turkey tail mushrooms have been an approved medical product in Japan since 1977, meaning that they are paired with just about every cancer therapy in Japan, including chemotherapy and radiation. Medicinal mushrooms, turkey tail mushroom in particular, are so widely used in Japan that as recently as 2004, it represented a full 25% of the total national costs of cancer care. Human evidence of the efficacy of turkey tail mushroom against cancer includes 262 gastric cancer patients who had received curative surgery were randomly assigned to receive turkey tail extract, PSK, along with standard of care or standard of care alone. Turkey tail improved both the 5-year disease-free rate from 59.4% to 70.7% and the 5-year survival rate from 60% to 73%. There were no additional toxicities from turkey tail extract. 579 gastric cancer patients who had their cancer resected were randomly split into a standard of care group or a standard of care plus PSK group. The 5-year survival rate for stage INV patients was 11.1% in the control group and 50% in the PSK group. The mean survival time of patients with liver metastases was 10.9 months in the PSK compared to 4.3 months in the control. A 2019 meta-analysis of 23 trials involving 4,246 people with various cancers found that turkey tail mushroom extract conferred a significant survival advantage over standard of care. A 2012 meta-analysis of 13 clinical trials studying turkey tail supplementation in a variety of cancers found that turkey tail supplementation was associated with a 9% improvement in 5-year survival. This is all done with virtually no side effects. Active hexose correlated compound, AHCC, is a fermented mushroom extract made primarily from shiitake mushrooms. It has been studied in humans since the 1990s and is popular, like many medicinal mushrooms, in Asia. Evidence for its efficacy in humans undergoing cancer treatment includes 113 liver cancer patients received 3 grams per day of AHCC post-surgery for over 9 years, and 156 were used as a control. AHCC lowered recurrence from 66.1% to 34.5% and decreased the mortality rate from 46.8% to 20.4%. It also significantly lowered the liver enzymes AST and GGT, all without inducing any side effects. MGN3, also known as BioBran, is a functional food made from breaking down rice bran with enzymes from shiitake mushrooms. It has 11 clinical trials and 14 clinical cases described in the scientific literature showing its efficacy against cancer in humans. Cancers it has shown efficacy against in human trials include prostate, breast, multiple myeloma, leukemia, B-cell lymphoma, liver cancer, and cervical cancer. One controlled trial in 205 people with a variety of advanced cancers found that the MGN3 group had an 18-month survival of 54.2% compared to 17.4% for the control group. Human trials also have shown that MGN3 supplementation leads to significant increases in natural killer cell counts and lethality. Probably the most impressive brand of mushroom supplements is Host Defense. Host Defense makes sure that they put mycelium into the capsule in addition to the fruiting body of the mushroom. Mycelium is the network of fine white filaments that feed the mushroom. Mycelium has been found to be immunologically active in different ways than the mushroom body itself. Host Defense also produces blended mushroom lines that have been shown to be more immunologically active than single strains. Mushrooms and mushroom extracts are quite simply one of the most important things someone can add into their anti-cancer regimen. We have far from exhausted all of the positive clinical trials we could present here showing their efficacy. For more information on mushroom extracts, see the book Cancer Self-Defense 101, Quick Tips to Help You Survive.